Bianca Feidelberg. I'm a project lead here at the Ontario Caregiver Organization, and I'm really pleased to welcome you to our session about how to include and support caregivers in Northern Ontario. And I'm joined here by my colleagues, Hannah Albany and Lisa Rafoul. And we're very, very pleased to have you here, and apologies about the chat function. We hope to resolve that next time. So I am going to pass it over to Hannah, who will kick us off with a land acknowledgement. Thanks, everyone.
Thank you, Bianca, and thank you to everyone for being here. As Bianca said, I would like to begin today's meeting by acknowledging the Indigenous peoples of the lands from which we are gathered. While we are connecting virtually with individuals joining us from different locations, it is important to recognize the significance of the land that we each call home. The location from which I am speaking today is situated on the traditional territory of the Anishinaabe people, covered by the Robinson Superior Treaty of 1850, and home to Fort William First Nation. I acknowledge that the lands across this country are the ancestral and unceded lands of the Inuit, Métis, and First Nations people who have inhabited this land for generations. It is essential to remember that our high quality of life is directly linked to the resources and relationships with Indigenous communities and people. As someone who is not Indigenous, I am committed to learning about the lands of which I live and work, and I aim to be a supportive ally by following the recommendations set out by the Truth and Reconciliation Commission. I also acknowledge the significant and enduring effects of residential schools and colonialism on Indigenous families and communities. And I kindly encourage us all to consider how we can work together towards reconciliation and collaboration moving forward. I'm so pleased to have the opportunity to meet with you all today, and would like to start off by taking a look at what we will be covering today, a little bit of an overview. So for those of you who are not familiar with OCO, we will start by sharing some information about the Ontario Caregiver Organization. We'll move on to talking about the critical role of caregivers and the unique experiences of caregivers in Northern Ontario. Then we will chat about ways that your OHT can include and support caregivers, including examples. And we will share practical resources and tools to advance caregiver inclusion and support. The Ontario Caregiver Organization exists to improve the lives of Ontario's 4 million caregivers, no matter what age they are, the diagnosis of the person they're caring for, or where they are in Ontario. We are a not-for-profit charity funded by the Ministry of Health, and at the center of our work is Caregivers. We offer a variety of free programs and services in both French and English to caregivers across Ontario, including a 24/7 helpline for caregivers to direct them to the supports and services they need for themselves and their care recipient. Our work also includes gathering insights from caregivers and engaging caregivers in program development and design. We also work with system partners like OHTs to recognize, include, and support caregivers at the point of care in healthcare and in community settings. Turning our attention to understanding the needs of caregivers in the North, as I'm sure you're aware, Northern Ontario is vast and generally has a very low population density with great distances between communities. Northern Ontario has a higher percentage of the population that is over the age of 55 than urban areas. And in Ontario, the basket of services enrolled in northern communities is less comprehensive, available, and accessible. As I'm sure many of you know, individuals living in northern communities often need to travel to urban areas to access the healthcare services they need. And 41% of rural caregivers and Northern Ontario caregivers report that financial challenges are the main stressor in their caregiving experience. Compared to caregivers in other areas, caregivers in Northern Ontario communities are more likely to be over the age of 55. They are less likely to be in contact with healthcare professionals, and they don't feel like they are seen as important compared to caregivers in urban regions. They are also least likely to use services for themselves or for their care recipient. And finally, they are the most likely to be in an intense caregiving situation, meaning more than 10 hours a week and for longer than a year. The caregiving experience in Northern Ontario, coupled with existing challenges for caregivers, has an impact on their health and the people they care for. Research shows that caregivers experience higher rates of loneliness, stress, and depression than non-caregivers. And research has shown that there's a connection between caregiving and social isolation. And there's the growing understanding of the detrimental impact of social isolation and the impact on our health. We also know that when caregivers experience burnout, it can lead to increased visits to the ER and or unnecessary hospital admissions. If we don't pay attention to caregivers as a population, there are consequences for caregivers, the people they care for, and the healthcare system. I will now pass it over to my colleague Lisa, who will share some of the opportunities to integrate caregivers in your OHT.
Thanks so much, Hannah, for setting the context about caregiving experience in Northern Ontario. I'm really excited to be here today to talk about caregivers as essential care partners. Essential care partners are when caregivers are formally recognized as being essential to patient care. There are approximately 4 million caregivers across Ontario, and it's worth noting that those 4 million caregivers provide an estimated 75% of the care in our health system. Many of you on the call today might identify as a caregiver. Some of you may be familiar with our Partners in Care equation, which you see before us. This illustrates how patients or clients or residents, depending on your care setting, caregivers and care providers working together are partners in care. That equation also contributes to the quintuple aim. In particular, caregiver inclusion and support enables things like improved transitions across settings and decreased emergency room usage and enhanced patient caregiver experience. As your OHT works to provide an integrated and seamless healthcare, we have a real opportunity to truly integrate caregivers in our health system and across OHTs so they are consistently empowered to be essential partners in patient care. The evidence is clear. Patients, clients, and residents do better when care partners are actively included and involved. And many of you can relate. This really became evident during the pandemic when caregivers were not able to be present or included due to visitor and caregiver restrictions. The unintended consequences of those restrictions provided additional evidence about the essential role of caregivers and benefits of caregiver inclusion. There are noteworthy benefits including essential care partners in your OHT. These benefits include improved patient care and safety, more equitable and culturally safe care, more successful care transitions, ALC prevention and mitigation, and improved healthcare outcomes, including lower readmission rates and sustained cognitive function among older adults. All these benefits add up to less pressure on the health system, improved efficiency for Ontario health teams and for their partner organizations. In March 2023, in partnership with Ontario Health, OCO launched the Essential Care Partner Support Hub. This initiative built on the work we have already been doing over the past 3 years, working alongside health system partners. This began at the onset of the pandemic when we started a learning collaborative with a focus on safe presence of caregivers in hospital and long-term care homes, and has evolved to an emphasis on inclusion in acute settings and beyond. We are really excited to offer essential care partner resources and support for Ontario health teams as they consider adopting and implementing practices that will not only improve the lives of caregivers, but will also have an impact on patient health outcomes. In the next few slides, I will walk through what we offer. We approach our work with healthcare organizations and OHTs focused on 3 key pillars that are interconnected with each influencing the other. These pillars are the identification and recognition of caregivers, including caregivers as partners in the care team, and connecting caregivers to supports for their own needs. At the foundation of this work is how caregivers are engaged in the planning and design. OCO offers large-scale learning events for OHTs like this one, tailored education sessions for providers, tools and resources to support you in your work. Implementation leads like myself who work in the ECP Support Hub collaborate with healthcare organizations and OHTs, providing guidance and support for caregiver inclusion initiatives across OHTs, and can work with you to connect caregivers to support. The identification of caregivers represents a commitment to caregivers and serves as a formal way to recognize them. The caregiver is designated by the patient, client, resident, or their substitute decision maker. And if the organization has capacity, the caregiver can be documented in the electronic medical record. We know that our system, and in particular OHTs, are facing enormous pressures to improve transitions in care and manage human resources. There is a chance to build the recognition identification of caregivers so that caregivers can be included and supported in plans of care across transitions. When caregivers are identified, it creates opportunities for support and connection and reduced isolation. Also, when caregivers are connected to support, we can prevent burnout and improve the patient and provider experience. OHTs can work toward this goal by implementing caregiver ID and/or documenting caregivers in patient files and records. For example, Hills of Headwaters Collaborative OHT implemented Caregivers in the Hills, a program that recognizes caregivers across the region. Their work is highlighted in the Essential Care Partner Program Implementation Toolkit for OHTs. As a system and as OHTs, you are working to meet the needs of vulnerable patients, families, and an aging older adult population. You have been tasked to move towards integrated and seamless care across settings. Some of the possibilities are to support coordinated and sustained care plans, as caregivers really know the patient and can offer key pieces of information that could otherwise be missed. Possibility to involve caregivers in the creation of those care plans, and to embed caregiver inclusion and support into your integrated pathways. To offer OHT-wide education sessions about the critical role of caregivers. Family caregivers are often referred to as the glue that keeps the healthcare system together, most evident in transition points across the care system. As you plan for your integrated care pathways, consider the important and valuable role caregivers have, especially for patient, residents, and clients who are more vulnerable or complex, reducing readmissions and improving overall patient outcomes. I'm now going to pass it back to Bianca to share a highlight of the work of the Algoma OHT.
Thanks so much, Lisa, and so relieved that the chat is working. So please do put your questions and comments in the chat, and we will try our best to answer some of your questions at the end. I want to thank you, Lisa, for providing a great overview of how OHTs can adopt and implement caregiver strategies. And I'm really pleased to present the work or highlight some of the work of Algoma OHT. I've had the privilege in my role of working with OHTs over the last few years to be closely connected to the Algoma OHT. And when I connected with Victoria Chetty-Klebos about her spotlighting this work from their OHT, she was thrilled to have the opportunity. And she's unfortunately not able to be here, but I can see there are many folks from the Algoma OHT Sioux area hospital on the call, including caregiver, patient partners. And I really just wanted to take a moment to thank you for really championing this work and the important role of caregivers across your region. Next slide, please. So just going back a little bit, Algoma OHT back in 2021 really focused on, prioritizing caregivers as one of their priority populations and getting the buy-in and support of the leadership team from their OHT to be able to move forward the important role and focus of caregivers and of implementing caregiver ID. So they piloted this work at Sioux Area Hospital in 2021, and with the goal of vision of really spreading this work, into another phase or beyond, spreading and scaling across the OHT. And I want to just make a note of how fundamental their patient, family, and caregiver involvement was. Folks were involved from the very beginning, and I think Victoria and team would say have been key enablers in really like making this work come forward and bringing it to life. And it certainly set the tone for the next phase of the work. And I'll just talk a little bit more about that in the next couple of slides. So at this time, there are over 580 caregivers who have been formally recognized as part of the program at Sioux Area Hospital. You'll see the image there of a Caregiver ID and Essential Caregiver Guide. This is a toolkit and guidebook that Algoma OHT has put together about the implementation of Caregiver ID across their region. And they've now moved to spread and scale at long-term care settings and Alzheimer's societies. And what evolved is in that winter of 2023, there were some conversations from Algoma OHT about really understanding the needs of caregivers within the Northern context, or better understanding the needs of caregivers in the Northern context before they moved into the next stages of the work. And so this really spearheaded a partnership between Algoma University, Sioux Area Hospital, caregivers, and the OCO to really consider the needs of caregivers and to offer some, focus groups and research to better understand caregivers and their in the North and their experience. So next slide, please. And what evolved, or what was brought to light, was just some key themes in the research that really, should come as no surprise that caregivers were viewed as a vital backbone to our health and social care system, and were, getting very overwhelmed navigating the demands of caregiving. And so certainly we heard Lisa talk about this, Lisa and Hannah talk about this earlier, but this really validated kind of what we knew, and in particular, it was challenging within the context of the Northern experience. There also emerged themes around, the caregiving role can at times create shifts in relationships and create tensions between family members. And certainly there was a reflection about the need for personalized supports, or supports that really understood or recognized the unique circumstances of caregivers within the Northern context. And lastly, of course, providing caregivers or empowering caregivers with training and support to ensure that they were well positioned to continue in their role. So this really sets us up for some opportunities. And certainly these are the opportunities that Algoma has identified, but I share them with you here today for you to think and consider about some of the opportunities for your OHT or your region as you're moving forward. So really, the first is continuing to increase the awareness and recognition of the role of caregivers. Looking to expand the Caregiver ID program and thinking about how caregivers can be identified across the system or across the OHT. Recognizing the importance of offering training both for caregivers and providers. When providers are well positioned to understand the critical role of caregivers, then caregivers can also feel supported in their role. And of course, caregivers are having the skills and tools and training they need in order to continue in their position or their offer of support. And then lastly is the importance of support for caregivers across the lifespan and how significant and important that is. I'm now going to pass it back to Hannah. She's going to walk us quickly through the last section of our slides focused on the pillar of support. So I'll pass it over to you, Hannah.
Thank you, Bianca. So going back to our earlier slides about how important supporting the caregiver is, the caregiver needs to be linked to support for both themselves and for their care recipient. As we learned in the research, that education and support is so important for family caregivers. So setting caregivers up for success includes empowering them with the knowledge they need to be successful in their role, whether their role is at home or in the community or in a hospital or long-term care. We recognize that you as OHTs have been tasked to improve access and navigation for patients and families, and there's an opportunity for OHTs to empower those caregivers and in turn be able to decrease caregiver burnout. An OCO can support OHTs to do this by being a point on their website that they can point caregivers towards for support and refer caregivers to our programs and services that I will talk about in just a minute, and or local caregiver support programs. We have a number of resources for OHTs with examples and actions on how you can include caregivers in your access and navigation models as well. And all of those links, as well as a copy of the slideshow, will be shared following the webinar. Today, I'd like to highlight two of OCO's programs for caregivers, the Ontario Caregiver Helpline and OCO's two peer support programs. The Ontario Caregiver Helpline is a one-stop resource for information and referrals, connecting caregivers to community-based information or services and support. Service is offered 24/7 in English and French, with interpretation services available in 150 languages. Our one-to-one peer support program allows caregivers to connect with trained peer mentors who are volunteers, and they connect over one-on-one phone calls to receive emotional support and discuss their caregiving challenges and needs. We also offer online support groups, and they're offered over Zoom, or caregivers can connect over the phone, and they're driven by caregivers to discuss their most important issues. Each group is facilitated by a trained peer support group facilitator with experience as a current or a former caregiver. Groups are offered at different times and days, and there are groups specifically for Francophone caregivers and young caregivers. Finally, I'd like to share a little bit about my role as the Northern Ontario Regional Lead. I have the opportunity to bring OCO into communities and develop relationships and partnerships with local organizations and caregivers. Some of the ways I do this is through raising awareness of OCO and caregivers at events, presentation and educational opportunities for both caregivers and providers. I participate in various local and regional committees that pertain to caregiving, and I also collaborate with organizations in order to enhance caregiver supports. And I want to highlight one recent collaboration that was done in partnership with Lakehead University and their Center for Education and Research on Aging and Health. And we adapted OCO's I Am a Caregiver toolkit to be more culturally safer for Indigenous communities. We worked with researchers there and their advisory committee to be able to really make this resource appropriate for Indigenous folks. It's pictured here up on the slide, and I will share a link to it in a follow-up email. The I Am a Caregiver toolkit also will be adapted into 5 additional languages this fiscal year. I will pass the floor back to Bianca now, and she will wind us up for today.
Thanks, Hannah. So I'm just seeing, just putting out for any questions from the audience, and then we'll quickly go to our last few slides. So Linda, I see your question. Does the interpretation supports with the 24/7 phone line also include translation for Indigenous languages? So my understanding is it does, and I see Hannah nodding as well. So there are over 150 languages, including Indigenous languages. You're welcome, Linda. And any other questions from the audience that folks want to pop in there? I know a question we often get from folks with OHTs is, where do you start maybe, or what's a good place to start? So we are happy at OCO to meet with any of you to talk a little bit about what we've seen other OHTs do in terms of implementation. And I also see a question here about the 8-week program. So the scale program that we offer, David, is available twice a year. It's online, but it's live during those periods. And it's really about mental health or well-being of caregivers. So thinking about how to how to support a caregiver, what might be some of the issues that could come up for a caregiver, and there's also an opportunity for a connection to group counseling after you participate in the 8-week program. Certainly feel free to reach out if you have any questions about any of our programs and services. We'd be happy to help you with that. And I'm just going to ask Lisa to go to the last couple of slides. So just as we wrap up here, oh, and I see one more question from Rose asking about, before I wrap up to these last couple of slides, can there be more than one caregiver for a loved one? So if you have a caregiver ID. So it's a great question, Rose, and it would depend on the setting or the organization. But many organizations, hospitals, for example, might support more than one caregiver. I'm going to ask Lisa to respond if she has anything else to add, but it certainly depends on the organization or hospital setting.
Yeah, thanks, Bianca, and thanks for the question. It certainly does. You're working with the organization, and so, having that conversation is really important. Many of the organizations would support more than one, in particular, for reasons, one caregiver can become fatigued and burnt out. There may be two people who are sharing the responsibility, and, I don't think you want to get into, numerous essential care partners, but certainly I think many organizations would support more than one. But again, it's and every person, patient, resident, client has their own individual circumstances. So it would be talking through that as well.
Thanks, Lisa, and thanks, Rose, for your question. Thanks, everyone else. So we have a couple of minutes, 1 minute left, maybe a couple of minutes left. So I just want to walk us through this last slide. So we really wanted to leave you with this idea that there is an absolute opportunity here. Certainly we heard what Algoma has done. There are other examples of OHTs that have worked carefully to implement some of these key practices or principles or pillars within OHTs. And you have existing programs and caregiver supports. You have this research project and learnings that we've shared with you. You have your priorities as an OHT focused on transitions, and we've heard today about how caregivers are the glue that keep everyone together in the system in terms of their role. And we encourage you to reach out to us at OCO. We have resources and tools and supports. We have specifically designed for Ontario health teams, and we're keen to work with you to really empower caregivers in their roles to ensure that they're supported and included as part of the care team. So we'll leave you with these key takeaways, which are resources and tools that are designed specifically for OHTs, including the links to the I'm a Caregiver toolkit as well. But you can see here there are toolkits for implementation, which includes a reflection on the work of Algoma and Hills of Headwaters Collaborative on implementing Caregiver ID. We have key practices for OHTs and also a module that's focused on including caregivers in access and navigation models. So as we wrap up, minute over, just wanted to thank you all so very much for attending today. Thank you, Hannah and Lisa, for the presentation together, and really appreciate everyone joining us for this half hour this afternoon, and wishing you all a lovely afternoon. Thanks so much. Take care.